Howdy, this is Dr. Branco with a quick video about the updated COVID vaccine for 2023-2024. As of right now, I want to let you know that we have the COVID vaccine for 2023-2024. This is not a booster the same way that the previous COVID vaccines were boosters. This is a updated vaccine, just like we update the flu vaccine every year for the different strains of flu that we expect to see. This vaccine is updated for COVID-19 XBB, and that is the variant that was circulating at the time the vaccine was released. It's actually shifted a little bit, but is still close enough to XBB that we're seeing good antibody response to this vaccine that's protective against the variants that we're seeing now. I'm going to give you lots of information, so this will be a bit of a long video. You may want to save it if you've only got a few seconds, but I'm going to start with the bottom line. The bottom line is that this vaccine is available and recommended for everyone over 6 months. Everyone will benefit from this vaccine. Some will benefit more than others. And so I want you to think about your own family and your family's priority and your children's risk, and to make that decision. We are always happy to help you with that and talk through and answer questions. I think that this vaccine will be super important for kids who have never been vaccinated, especially those who have also never tested positive for COVID. It's going to be very important for kids who are high risk, who may have some underlying illness or immune compromise. It's going to be important for those kids who have high risk contacts, and so if they are spending time with someone who's elderly, over 65, with an infant under 6 months, someone who's undergoing cancer treatment or has some other immune suppression or some chronic disease, then this vaccine is going to be really important for them. If your child has had the original COVID vaccines but hasn't had a bivalent booster, then it's been over a year since their last COVID vaccine. It'd be a good idea to get this updated. If your child's never tested positive, and likewise, they likely haven't had a boost in their protection or an update of their protection. And then if your child is up to date with all of the COVID vaccine and the bivalent booster, but you are interested in decreasing their risk of a serious illness and decreasing their risk of testing positive, then this vaccine is a good idea. Again, we're always happy to talk through any of these issues and answer questions and help you make this decision. Feel free to send a portal message or give us a call. And now for some details. Like I said before, this is not a booster vaccine. This is an updated vaccine for the current variant that's circulating of COVID. I know we're all a little tired of thinking about and talking about COVID, but it is a part of our life now and will be around. It will be one of those viruses that circulates. Based on some data on COVID's behavior across the world, as well as what other coronaviruses do, we expect that COVID will increase in the wintertime. We did see in the wastewater, which is our best way of tracking COVID in our community, we saw a little bump in COVID with the summer travel season, and we're fully expecting to see that again in the winter. The COVID vaccine that we're getting now is for everyone over 6 months. And so for infants, toddlers, children, teens, adults, and the elderly. We are getting a lot of questions about when should I do this vaccine if I've had COVID recently. And it makes sense to wait at least 2 to 3 months after you've had COVID. And some of the data shows that you can wait up to 8 months, and that waiting 8 months will give you the best response in terms of antibody. Of course, if it's been 8 months since you've tested positive and that puts you past the winter, I would recommend getting the vaccine as long as it's been at least 2 to 3 months. And the reason for that is we want to boost your protection as you're going into the winter season when we expect to see more COVID. Why did we develop this vaccine? And again, we're all ready for COVID to be over, and we're all ready for it to just be, a cold and not a serious illness. It turns out that for most people, and certainly for most kids, COVID has been a pretty mild illness, and so we're very grateful for that and happy that we have not had a lot of kids who are seriously ill. But it is still true that severe COVID disease is similar to the flu, that infants under 6 months have the highest rate of hospitalization. They're second only to the elderly and to those over 75. Kids between 5 and 17 are the lowest risk, and we're grateful for that. The hospitalization rates, the number of kids who are hospitalized, is lower than for the flu, but is those who are hospitalized tend to be sicker, and so more of them end up in the ICU. Of those kids who are hospitalized, only about half of them have some other illness. And so it's not true that COVID only affects kids who have some other underlying illness like asthma or cerebral palsy or a seizure disorder or diabetes or a heart condition. Half of the kids who were hospitalized with COVID were previously totally healthy. The other thing to think about is, other vaccines or other diseases that we vaccinate against, like chickenpox, hepatitis A, and pneumococcus, which causes pneumonias and meningitis and bloodstream infections. COVID hospitalization rates are still higher than all three of those. And so, again, while it's not a common occurrence, it's still something that we worry about and still more common than some of the other conditions that we vaccinate against. Another thing to think about is long COVID, and there is good data that vaccination decreases the risk of long COVID. The other thing that has decreased the risk of long COVID has been the variants, and it seemed like the first COVID that we saw did cause more long COVID than the Omicron and other variants that we're seeing now. But it is still something that we see and we worry about it. We definitely see it in kids, and the rates are highest among young adults, and so between age 18 and 49. Last fall, we had an updated vaccine. We had the bivalent vaccine, which included an Omicron strain, and that worked well. There was a 60% drop in ER and urgent care visits, and a 65% drop in hospitalizations after that vaccine was introduced, among people who received that vaccine. And so, getting an updated vaccine does help. It does not mean that you won't test positive. And there's a topic that we talk about a lot with both flu vaccines and with COVID vaccines. Being vaccinated against flu doesn't guarantee you won't get the flu or test positive for the flu. It clearly makes the illness less severe. And the same seems to be true for COVID, that while some people still test positive even when they've had all the vaccines and all the boosters, there is a 30 to 60% decrease in the risk of testing positive, and it keeps you out of the hospital for sure. We had a lot of conversations over the summer with families whose children were eligible for a bivalent booster, and a lot of the advice centered around how disruptive would testing positive for COVID be for your family? Do you have a camp or a trip or some family event planned, and we can't guarantee that you won't test positive and miss that event, but we can decrease the risk. And so for those families who wanted to add some protection, this same conversation is going to happen this fall around school, around parents missing work, family trips and events and all those sorts of things. And so again, we can't guarantee you're not going to test positive and have to miss the events, but testing positive for COVID is still something that disrupts and interrupts those schedules. So the vaccine is safe, and while it's not 100% effective, it is somewhat effective at protecting you, and so I say that is a good reason to do it. In terms of vaccine safety, one topic, there are a lot of folks who had a worse reaction to the mRNA vaccines than to other vaccines, and so more fever and body aches and headaches and fatigue. The one concerning side effect that we saw was myocarditis, which was an inflammation of the heart muscle that was seen. The highest rates were in teen males, and that is something that we did not see with the bivalent booster, with the Omicron strain, and in booster doses. And so it seemed to be highest with the original vaccine and with the primary series of vaccines, and not with the subsequent doses or booster doses. And so we're feeling pretty good about the safety of this vaccine. There is a new vaccine, or another vaccine, that has recently been approved, made by a company called Novavax. This is not an mRNA vaccine. This vaccine is a protein-based vaccine, so it's more similar to most of the other vaccines that we use, where we give your body a protein that looks like the virus or an antigen, and then your body responds to that and makes antibodies. The mRNA vaccines that we're using now, we're doing it one step before. So we're giving your body the blueprints, the instructions. Your body then makes that protein and your immune system responds to it. It's turned out to be a super effective way of creating an immune response, and you may have heard that the folks who perfected this technique just won the Nobel Prize for their work on developing the mRNA vaccine platform. It's very well deserved. But the new vaccine is different. It's the protein-based vaccine. I'm sure many folks are wondering, since I've had mRNA vaccines, should I now get a Novavax? Is there an advantage to my immune system responding in two different ways? And the answer is, we don't really know, but maybe. There is very limited data on mixing mRNA and the Novavax vaccines, and so it's not something that we can recommend across the board. The one group of people, of kids and adults, who I would say it's a good idea to get the Novavax vaccine are those who had a pretty bad reaction to the mRNA. And so if every time you got your COVID vaccine, you're feeling pretty sick for a day or two, then it may not be a bad idea to get a Novavax, because you would likely have less of a reaction to that. We don't currently have Novavax in our office. That is something that we'll have to look into, whether we can offer that. And then the final thing is it is totally fine to get the COVID vaccine and the flu vaccine at the same time. And so if your child is in the office and they're due for both, then we are happy to do both and get them protected against the flu and protected against COVID for this winter. And so just to reiterate, the bottom line, this vaccine is going to be beneficial for everyone. There are some who will benefit more than others. And so the elderly and the younger kids, children who have never been vaccinated, I would highly recommend that you get them vaccinated. And we're happy to talk through how many doses they need and so on. For children with high-risk conditions, and so seizure disorders, any respiratory disease, lung disease, heart disease, diabetes, cerebral palsy, other neurologic diseases, any immune compromise. Those kids should definitely be protected. Children who live in a home or spend a lot of time with someone who is high risk, and so if your kids are spending time around grandparents, it's important to protect themselves so that they can protect them. If there's an infant less than 6 months in your life, then please make sure everyone is up to date on their COVID vaccine to protect that baby. If there's anyone in your child's life with chronic disease, with cancer, with immune suppression, then they should be protected. If your child has not had the bivalent booster, then I would recommend that they get this updated vaccine. Likewise, if they have never tested positive for COVID, then improving their protection with the vaccine was a good idea. And then finally, I do feel that kids who are up to date with the vaccine and have had the bivalent booster will still benefit from this vaccine in that it will decrease their risk of testing positive. It won't eliminate it. It probably won't significantly improve their protection against hospitalization and severe disease, but as COVID changes and there are new variants, then that will become a factor for sure. I hope this has been helpful. Again, as I said, we are happy to answer questions. Please send a portal message. Please give our office a call and stay healthy.